Hi, dear students. Today we are going to deal with a topic that is a microscopic structure of male reproductive system. Before moving to the microscopic structure of testes, first we should have a brief idea regarding some of the salient features. So what are the structures that coming under the male reproductive system? So the first thing that comes to your mind when you think of the male reproductive system is the testis. Testis is a male gonad. It is paired structure and it is homologous to the ovary in the females. And this testis is situated in a muscular bag that is called as scrotum, which lies outside the abdominal cavity. So the testis is placed outside the abdominal cavity and the production of sperms are happening in the testis. And this temperature is less compared to that of the abdominal cavity. So for the production or the normal process of spermatogenesis, the temperature should be maintained. So it should be lower than the abdominal cavity. So some mechanisms are existing for that, and one is the placement of the testis outside the abdominal cavity in the scrotal sac, and other mechanism is the counter current mechanism. So there is paminiform plexus of testicular veins. The veins is forming a paminiform plexus which is surrounding the testicular artery. This also maintain the temperature which is accurate for the production of the sperms. And in addition to that, there is some genital ducts and accessory sex glands which contribute to the semen. And these structures we can see in this diagram. The epididymis carry the spermatozoa from the testis and continues in the vas deferens. So the vas deferens is the continuation of the epididymis. The vas deferens, after a course in the scrotum, it is entering into the anterior abdominal wall. From there, it crosses the pelvic brim and enter the anterior part of pelvic cavity. So seminal vesicles which are placed under the base or at the base of urinary bladder gives a duct. So the duct of the seminal vesicle which unite with the vas deferens or ductus deferens and form an ejaculatory duct. This ejaculatory duct opens into the prostatic urethra. So the part of the male urethra which transverses the prostatic gland is called as the prostatic urethra. Then this prostate is an important gland for its secretion which helps in the maturation of the sperm, and also its prostatic secretions which contribute the amount of semen. The testes have two important functions. One is the production of the gamete or spermatozoa, and the second one is the production of testosterone. Testosterone is a male sexual hormone. It can stimulate the accessory male sexual organs and causes the development of the masculine extragenital sex characteristics. The testis is surrounded by three coats. The first one is tunica vaginalis. It consists of two layers, that is the outer parietal and inner visceral layer. The second one is tunica albuginea. It is white fibrous. It is very dense coat and it covers the testes all around except the region posteriorly where there is entry of the testicular nerves and vessels. Posteriorly, this tunica albuginea is thickened and form mediastinum testis. From the mediastinum testis, some septa will arise and these septa will radiate towards the tunica albuginea. So dividing incompletely the parenchyma or the substance of the testis to 200 to 300 lobule. And each lobule will contain 1 to 3 or 1 to 4 seminiferous tubules. Then inner to that the next coat that is called as tunica vasculosa. It is the innermost coat and this is a vascular coat of the testis which lines the tubules. The seminiferous tubule is in the form of a loop. Both ends of the loop become continuous with a straight tubule. So, the seminiferous tubule join together at the apexes of the lobule and form 20 to 30 straight tubule which enter the mediastinum. Between the lobule, there is connective tissue which is loose connective tissue and it contains blood vessels and lymphatic tissue. In this connective tissue, there are group of interstitial cells or interstitial cells of LEYDIG which have endocrine function which produce male sex hormone and it contains yellow pigment. The cytoplasm of the interstitial cell contain yellow pigment. So, near the apex, the seminiferous tubule lose their convolution, join one another and form about 20 to 30 large straight tubules known as tubuli recti. The straight tubules anastomose or they form a network in the mediastinum testis that is called as rete testis. This rete testis give 12 to 20 efferent ducti. This pass from the upper part or the upper pole of testis into the epididymis. You can see the epididymis that is seen on the posterior aspect of the testis. It has head, body and the tail. So the head of the epididymis is formed by this highly convoluted continuations of the efferent ductules. Then at the lower end of the head of the epididymis, these tubules, efferent ductules, join together and form a single tube that is called as the duct of epididymis. This duct is also highly coiled on itself. It forms the body and the tail of epididymis. The tail of the epididymis, which consists of the duct of epididymis, it continues with the ductus deferens. At the lower end of the tail of the epididymis, the duct becomes continuous with the ductus deferens. So in this slide, I am going to summarize the important aspects before moving to the microscopic structure of the testis. So we've seen that the testis lie in the scrotum. It is covered by three layers, three coats. That is the outer one is the tunica vaginalis. The next one is tunica albuginea. And between the lobule, we are seeing the tunica vasculosa. And you can see how this tunica albuginea posteriorly, it thickened and formed the mediastinum testis. It gives off a septa and it enters into the substance of the testis. So dividing the parenchyma or the glandular part of the testis into so many lobules. And each lobule is containing 1 to 3 or 1 to 4 seminiferous tubules. And between the tubules, we can see the connective tissue. And this connective tissue will contain the lymphatics, it will contain the blood vessels or interstitial cells of LEYDIG. And then you see that the seminiferous tubule is forming the straight tubule. It anastomoses in the mediastinum testis, that is rete testis. From the rete testis, you are getting 12 to 20 efferent ductule. And this ductule is highly convoluted. It is forming the head of the epididymis. Then it continues as a highly called single tube that is called the duct of the epididymis. It is forming the body and the tail of the epididymis. Then it continues as the vas deferens or ductus deferens. So coming to the section of the histology or the microscopic structure, we are seeing the sections of seminiferous tubule. So we can see the coverings, that is the tunica albuginea. We can see the cut sections or the cross sections of seminiferous tubule, and in between the seminiferous tubules we will draw the connective tissue and will contain the interstitial cells of LEYDIG, blood vessels, nerve cells. All these things you can expect it to see in that area. In this slide, you can see the panoramic view of the testis, which show the mediastinum with retate testis and dividing the substance or the parenchyma of the testis into so many lobule, and you can see the lobule, and the lobule is containing the seminiferous tubules. This is the microscopic structure of testis. The first thing you can see here is tunica albuginea. It is dense fibrous coat. The second to this or deep to this tunica albuginea is represented as tunica vasculosa. From the name suggests it is vascular. Within the substance, what you can see is the parenchyma of the testis is dividing into lobule, and each lobule is containing the sections of seminiferous tubules. The seminiferous tubules are highly convoluted. So each tube is cut up several times in any section through the testis. For that, the tubules assume various shapes. And between this tubule, we can see the connective tissue, that is interstitial connective tissue, which contain the blood vessels, lymphatics and the nerve. Also, in the connective tissue of the testis, between the lobule, you can see the interstitial cells of LEYDIG. The wall of the each tubule is enclosed by a thick basal lamina, which also contain muscle-like myoid cells. So the contraction of these myoid cells help to move spermatozoa along the tubule. So between this basal lamina or the connective tissue and the lumen of the tubule, we can see several layers of cells, and the cells are resting on this basal lamina, and the cells are of various sizes and shape. So the seminiferous tubule represents a complex stratified epithelium which contain two distinct group of population. One is called spermatogenic cells, otherwise referred to as germ cells. So most of these cells represent the stages in the formation of spermatozoa. Other cells which have supportive in function, they are called as sustentacular cells, or otherwise the cells of Sertoli. To brush up your memory that you studied during embryology, we can see the primordial germ cell, that is spermatogonium. It is diploid in nature, and this spermatogonium, which undergo the mitotic division and produce the primary spermatocyte, that is also diploid in nature. And this primary spermatocyte, it undergoing the first meiotic division and producing the secondary spermatocyte. Then there is reduction of chromosome number. So 2 haploid cells you can see here. Then each secondary spermatocyte is again undergoing the second meiotic division and then produces the spermatids. So from one spermatogonium you are getting 4 spermatids, and this spermatid undergo the process known as spermiogenesis, and finally sperm is formed, which is haploid in number. So in the section of the seminiferous tubule, the basal one next to the basal lamina, you are seeing the spermatogonium, and this spermatogonium is dividing mitotically and producing the next, that is the primary spermatocyte. So this spermatogonium will mitotically divide and produce the stem cells as well as the primary spermatocytes. So this primary spermatocyte is producing secondary and from the secondary spermatids are produced, and from the spermatid the sperms are produced. So these stages we can see in the section of the seminiferous tubules. In this picture, we will get a close view of seminiferous tubule. Here what you can see is there is the basal lamina around one lobule, and we can see some smooth muscles around it, that is muscle like myoid cells also in the wall of the seminiferous tubule. So within that we can see the different stages of spermatogenesis. The most basal one is called as spermatogonia, and this spermatogonia will undergo the mitotic division and producing the primary spermatocyte. So primary spermatocyte will be larger among the cell population what you can see in the seminiferous tubule. So first, the most basal one nearing to the basal lamina, we are drawing the spermatogonia. The next what will you draw is the primary spermatocyte. This primary spermatocyte further undergo the meiotic division to reduce the number to haploid. So you will get the secondary spermatocyte. So you have to remember that the cell population, when you draw towards the lumen, the number will increase. That is, from one spermatogonia, finally you are getting 4 spermatids and sperms. So the crowd will be, the cell population will be more toward the lumen. So first is spermatogonia, then it undergo mitotic division. So you will get the stem cell for the production of further cell plus primary spermatocyte, and this primary spermatocyte is giving rise to the secondary spermatocyte. The secondary is undergoing again meiotic division and producing the spermatids, and this spermatids is undergoing the process of spermiogenesis and producing the sperm. You can see here the head is directed toward the its head is away from the lumen. You can see there the sperms are arranged like this. So this, in addition to this population, this is a germinal epithelium which represent the different stages of spermatogenesis. In addition to that, in between these cells, we can see some elongated nuclei or the elongated cell which looks pale in color. These are called as Sertoli cells. So what is the function of the Sertoli cell is that it is supportive in function. So it is supporting the other cells, that is the different stages of the spermatogenesis is supported by these Sertoli cells, and it is also called as sustentacular cells. So the number is less compared to that of the spermatogenic cell, but you can see the Sertoli cells in between with elongated nuclei. So this is the structure of one seminiferous tubule. What you can see is, you can draw that is the basal lamina. Then next to that, the next layer is the spermatogonia. Then you will represent larger compared to that among the cell population, that is the primary spermatocyte. And then you can draw the spermatids, that is number is numerous compared to that of the number of spermatogonia. So numerous cells but size is less, but chromosome number is haploid in number, so size is less. And then you can draw the sperms from the spermatids. So these are all are suspended or held on by means of this Sertoli cells. So this is the structure. So in the diagram you can draw so many sections of this seminiferous tubules, and in between the seminiferous tubule we can see the connective tissue which represents some blood vessels and these are the interstitial cells of LEYDIG. So in nutshell, how to draw this is, first tunica albuginea, then we will draw the cut section of seminiferous tubule. So in between the seminiferous tubule, there will be the presence of connective tissue, which showing the blood vessels, which showing the interstitial cells of LEYDIG, which occurs as clusters. Then taking into the consideration the section of seminiferous tubule, you will draw the basal lamina, then spermatogonia, then spermatocyte, spermatid and sperm. So the tail of sperm toward the lumen and head is in hold with the Sertoli cells. So evenly in between this stratified epithelium or germinal epithelium, you will draw the Sertoli cell, which is elongated, extending from the basal lamina to the lumen with ovoid nucleus, and it appears pale in color. So the salient features of this testis covered by tunica albuginea. Then you can see the cut section of seminiferous tubule, which represents stratified epithelium or germinal epithelium, which represent the stages of spermatogenesis, that is spermatogonia, spermatocyte, spermatid and sperms, and the supporting cell, that is Sertoli cell and sustentacular cell in between, which is with ovoid nucleus. Then between the seminiferous tubule, presence of interstitial connective tissue, which contain interstitial cells of LEYDIG, blood vessels and lymphatics also we can see. And outside to that of basal lamina of seminiferous tubule, muscle-like cells, that is myoid cell, also present. So this is a structure of testis. Sertoli cells are epithelial cells. They are the supporting cells. They are tall columnar cells with ovoid nucleus. So the length extends from the basement membrane to the lumen of the seminiferous tubule. So it is supporting the proliferating and differentiating germ cells. So it surrounds them. It provides pockets around these cells and hold these cells. So it provides nutrients. It also phagocytosing the excess spermatid cytoplasm, which is not needed in the formation of spermatozoa. In this picture, we can see the Sertoli cells. The number of Sertoli cells is less than that of the spermatogenic cells, and they are evenly distributed between them, and it is elongated. It is perpendicular. Its direction is perpendicular to the wall of the tubule. It is extending from the basement membrane up to the lumen. That much tall is a cell. It is a tall columnar cell, and the shape of the nucleus is ovoid, and prominent nucleolus can be seen for this nucleus. It has some process laterally, that is a lateral process, and this lateral process of one Sertoli cell is connected to the lateral process of the next Sertoli cells. So they are interconnected by means of a tight junction. It forms the basis of blood-testis barrier. So the spermatocytes or spermatogonia are protected from the blood. So spermatogonia and the primary spermatocytes are located in the basal compartment, and other cellular stages are located in the luminal compartment toward the lumen. So this is how the Sertoli cells are located there. So the lateral process of two Sertoli cells are connected by means of tight junction. So seal the tubule into two compartments. The basal part, that is close to basal lamina, and adluminal part means it is towards the lumen. So large molecule cannot pass between the basal and adluminal compartment, and this is called the blood-testis barrier. Like all epithelial cells, the Sertoli cells are avascular. So its main function is it support the germ cell progenitors and help to transfer the nutrients to the cells from nearby capillaries. And the other function is it form the blood-testis barrier. Then third function, it also produce testicular fluid including a protein. So it binds to and concentrate the testosterone, which is essential for the development of spermatozoa. And the fourth one is it helps to translocate the differentiating cells towards the lumen. It also phagocytoses the degenerating germ cells and surplus cytoplasm remaining from the spermiogenesis. The next group of cells, that is the Leydig cells or interstitial cells. They are seen between the tubules in the connective tissue. They have pale cytoplasm. It contains many cholesterol lipid droplets. They are endocrine component and they synthesize and secrete testosterone. They occur in clusters. So we can see as a clusters in between the seminiferous tubule, which are richly supplied by the capillaries, and the cytoplasm is strongly acidophilic, and the nucleus is large and often located eccentric in the cells. So when you draw in between the seminiferous tubules, you have to draw as a clusters, and the nucleus is large and the cytoplasm is strongly acidophilic. The Leydig cells make and secrete testosterone in response to the luteinizing hormone or LH from the pituitary. The cholesterol is used. It is the first step of testosterone production. Testosterone, it promotes the production of spermatozoa, secretion from the accessory sex glands, and acquisition of male secondary characteristics. So this process does not start until puberty, when LH stimulate the Leydig cells to produce testosterone. Then FSH or follicle stimulating hormone stimulate the Sertoli cells to secrete androgen binding protein into the lumen of the seminiferous tubule. So binding of testosterone in the lumen provides a local testosterone supply for the developing spermatogonia. As we've seen in the beginning, there are some genital ducts. So the looped seminiferous tubules in the testis, it is connected to the genital duct system, which transports the spermatozoa and fluid component of semen to outside. This duct system is made up of tubular recti, that is the short straight tubules. Then these connected to each other are forming a network in the mediastinum testis called rete testis. Then this empties into the efferent ductules or ductula efferentes. Then it is leading into the duct of epididymis or the ductus epididymis. Then this ductus epididymis empties into the vas deferens, which empties into the ejaculatory duct, which empties into the urethra and passes to outside. Epididymis, we've seen that it consists of head, body and tail. And the body and the tail, it consists of the duct of epididymis. And the duct of epididymis is a storage, or the ductus epididymis is a storage reservoir of spermatozoa. Then this spermatozoa mature here and they are competent enough to fertilize ova. So fluid is absorbed here. So the epithelium here is secretory. The epithelium that is seen in the epididymis, the lining epithelium, is pseudostratified epithelium. It consists of stereocilia, that is immotile cilia, that is the stereocilia, which are in fact very long microvilli. So the lining epithelium of the epididymis is pseudostratified epithelium with stereocilia. And these are thought to be involved in the absorption of fluid. The cells also thought to be secretory but the nature of the secretion is unknown. Grossly, we can see that the epididymis have head, body and the tail. So when we look into the components, what is forming the head, body and the tail, structurally we can divide into two parts. The head, which is formed by the highly convoluted efferent ductus, that is lined by ciliated columnar epithelium. Coming to the body and the tail, as we seen earlier, this ductus, this convoluted ductule later joined to form a single duct. That is called the duct of epididymis, which is forming the body and the tail. So that part is lined by pseudo-stratified epithelium with stereocilia. In this picture, we can see the cut sections of the duct of epididymis. The lining epithelium, what you can see here is the pseudo-stratified columnar epithelium with stereocilia. So as the name pseudo-stratified, it appears as stratified, but it is pseudo. All the cells that rest on the basement membrane, but due to the representation of the nuclei at different level, it is called as pseudo-stratified epithelium. So two groups of cells are present in this lining epithelium. One is a tall cell. They are called as the principal cells. And then the other group of cell that is seen towards the basal lamina, they are called the basal cells. So number of small nuclei we can see to the basal lamina. These cells, the basal cells, regenerate the epithelium. Outside to this epithelium, outside to the basement membrane, we can see smooth muscle layer. And these smooth muscles will produce peristaltic contraction, and by the contraction of this smooth muscle, the spermatozoa can move to the middle segment of the duct, which is the site of the final functional maturation of the spermatozoa happens. Now the immotile spermatozoa become motile. So they are motile here. The terminal segment of the duct of epididymis is the site of storage of the mature spermatozoa. The smooth muscle fibers of this terminal part do not contract spontaneously. They contract during the sexual stimulation concurrently with the contraction of the musculature of the vas deferens. So, see the salient features. That is a microscopic structure of epididymis. What you can see in histology is the cut sections of the duct of epididymis here. The cross sections you can see here. And this in between the cross section, we can see the presence of connective tissue with blood vessels and lymphatics. So, taking the section of the duct of epididymis, what you can see is a lumen. And the lumen consists of sperms. Then you can see the lining epithelium, that is pseudo-stratified columnar epithelium with stereocilia. Then the lining epithelium that rests on the basement membrane. Two group of cells, principal cells that are tall cells, and toward the basal part you can see some round nuclei. They are the basal cell, they are the short cells, they are the regenerating cells. They give rise to the other epithelium. Outside to that, there is a smooth muscle layer. Its contraction helps in the movement of the spermatozoa. First deferens is a muscular tube. The wall from inside out. There are three components. First one is mucous membrane. It includes the lining epithelium with lamina propria. The second is muscle layer, and the third is connective tissue or adventitia. So this is the mucous membrane. The mucous membrane, as you know, it includes the lining epithelium and the lamina propria. In this diagram, what you can see, the epithelium is simple columnar epithelium. If you are drawing the distal part of the duct, then this epithelium will change into pseudo-stratified columnar epithelium. Then, the lamina propria is supporting the epithelium, which consists of elastic fibers. Extra-abdominal part of the duct is ciliated part. The muscular cord is very well developed in vas deferens. In general, we can speak it consists of three layers. That is inner longitudinal, thick circular and outer longitudinal layer. So that means that a layer of smooth muscle which is circular layer of smooth muscle is lying between the inner and the outer longitudinal layers. In nutshell, regarding the microscopic structure of vas deferens, what you can see here is the mucosa is thrown into fold. So the lumen appears star-shaped, and the mucosa consists of epithelium and lamina propria. If it is in the proximal part, it is lined by the columnar epithelium, simple columnar epithelium. If in the distal part, it is lined by pseudo-stratified ciliated epithelium. Then followed by the second layer, that is the muscle coat or muscular layer. It consists of three components, that is the inner longitudinal and middle thick circular layer of smooth muscle and outer layer of longitudinal muscle. Outside to that is this adventitia or the connective tissue, which consists of connective tissue, blood vessels, nerves and the other components of connective tissue. The muscular layer is a structure which makes a vas deferens palpable in the spermatic cord. So it means that the muscular layer is very prominent. And the third layer, that is the connective tissue or adventitia, which is slightly denser than usual. Prostate is a gland that is seen just below the neck of the urinary bladder in the case of males. It consists of two components. One is the glandular component and the other one is fibromuscular stroma. So the glands are compound tubulo-alveolar glands. There are 30 to 50 compound tubulo-alveolar glands. And these glands are embedded in a framework of fibromuscular tissue. So in this diagram, you can see the sections of the glandular elements or the glandular tissue. It is in the form of a follicle and it is lined by the simple columnar epithelium. And the epithelium of these follicles are thrown into fold along with some connective tissue. So each follicle is thrown into fold on itself and the lining epithelium of this follicle is simple columnar epithelium. And these follicles are draining into the duct, that is 12 to 20 excretory ducts are there, which opens into the prostatic urethra. And the ducts usually lined by the double layered stratified epithelium. Superficial layer is columnar and deeper layer is cuboidal. Within the follicle, what you can see is amyloid body or corpora amylacea. What is this structure? They are round masses of uniform or lamellated structure within the follicles. It is more abundant in the case of older individuals. They consist of condensed glycoprotein and they are often calcified. This is called as amyloid body. They are the contents glycoprotein and often calcified, and they are more abundant in the case of older individual and seen within the follicles. Other than the glandular elements or tubuloalveolar glands, the important feature in the prostate is fibromuscular stroma. From the name itself, fibromuscular. It contains the muscular component, smooth muscle component, plus the collagen fibers. So it is called as fibromuscular stroma. So within the gland, this fibromuscular stroma, it forms the septum which separate the glandular elements. These septa are continuous with the fibrous capsule which surrounds the prostate. The capsule contains numerous veins and also some parasympathetic ganglion cells. So prostate is also covered by capsule. Some important functions of prostate. One is it produces secretions. It forms a considerable part of semen. It is rich in enzymes and citric acid. Rich in enzymes like acid phosphatase amylase protease. It also produces prostaglandins. So, the glandular part of the prostate is purely developed at birth. Its considerable proliferation is seen at puberty and it degenerates in old age. And the prostate is traversed by prostatic urethra. It is also traversed by the ejaculatory duct. The gland is divided into lobes. This picture shows the section of the prostate through which this prostatic urethra or the part of urethra that passes through the prostate in the case of male is called prostatic urethra. This urethra is in the form of a crescentic shape and this urethra will be lined by the transitional epithelium or urothelium. On the basis of the differences in the size and nature of the gland, the prostate can be divided into the outer zone and internal zone and innermost zone that is around the prostatic urethra. The glands in the outer zone are the main prostatic glands. They open into the long duct that later join the urethra. Internal glands, they have the short ducts. They also opens to urethra. Innermost glands, they are directly opening into the prostatic urethra. So, the internal plus the innermost zones of the prostate, it is called a central zone. So, it is a site of benign hypertrophy in old persons. The peripheral zone, that is the site of carcinoma. That means the peripheral zone which contains the main prostatic glands, that is the site of carcinoma. An enlargement of the prostate can compress the urethra and cause difficulty in the passage of urine. So in nutshell, regarding the prostate is it consists of two components. The glandular component, that is compound tubuloalveolar glands, and fibromuscular stroma. So you can see the follicles which is lined by simple columnar epithelium. Within the follicles, presence of amyloid body or corpora amylaceae, and the fibromuscular stroma divides or separates these glandular elements. Fibromuscular stroma, from the name suggests, it consists of fibrous component, that is collagen fibers, and muscular component is the smooth muscle. Nutshell of the present session. So the important microscopic slides that we are studying is testis, epididymis, vas deferens and prostate. First one is testis. In the microscopic structure, you can see the tunica albuginea, then the tunica vasculosa, and the important striking feature in the testis is cut sections of seminiferous tubule. So each seminiferous tubules is consists of stratified or complex stratified epithelium or germinal epithelium. It is surrounded by basal lamina, and within this basal lamina or from the basal lamina to the lumen of the tubule, there are different stages of spermatogenesis. The cells we can see there: spermatogonia, primary spermatocyte, secondary, and spermatids. And this in between this different stages of spermatogenesis, even arrangement, in even arrangement, you can see some Sertoli cells. They are long, tall columnar cells with ovoid nucleus and pale in color, extending from the basal lamina to the lumen. So they are the supporting cells. There are so many cut sections or seminiferous tubules you can see in the section. In between these cut sections, we can see the interstitial connective tissue. We show the blood vessels, nerve fibers, and the lymphatics. In addition to that, in the connective tissue of the testis, you can see some cluster of cells between the tubule. They are called as interstitial cells of LEYDIG, important for the production of testosterone. So which is responsible for the appearance of the secondary sexual characters in male. And the next structure what you can see here is epididymis. In that, what you can see again, the cut sections of the ducts of epididymis. It is again lined by the lining epithelium is pseudo-stratified columnar epithelium with stereocilia, and stereocilia is immotile. So two groups of cells are there. Principal cells, they are the tall cells, and the basal cells toward the basal lamina with round nuclei you can see there. It is actually producing the other cells. Within the lumen, you can see the sperms. And this is lined by, outside to the basement membrane, there is some layer of smooth muscle is present, and that is responsible for the movement of spermatozoa. So this is the structure of epididymis. The next one is vas deferens. Here the consist of three layers. Mucosa, which consists of the lining epithelium and the lamina propria. The lining epithelium is simple columnar. In the case of proximal part, if you are drawing the distal part, the epithelium will be pseudo-stratified. Pseudo-stratified columnar epithelium. If you are drawing the extra-abdominal part, again you can put the cilia. Then outside to this, there is lamina propria, which contain the elastic fibers. Outside to the mucosa, there is a muscular layer. Muscular layer consists of three. That is inner longitudinal circular layer, which is very thick, circular smooth muscle, and outside to that is the outer longitudinal layer. That is the second layer. Outside to the muscle layer, what you can see is the adventitia or the connective tissue. So this is the structure of vas deferens. Then finally the prostate. Prostate is gland. It is situated beneath the neck of the urinary bladder, below the neck of the urinary bladder. It consists of two components, that is the glandular component and the fibromuscular stroma. The glandular component shows follicles, which is irregular, thrown into fold, and lined by the simple columnar epithelium. Inside the follicle, we can see the amyloid body or corpora amylacea. It is more in the case of old people. Then, in between the follicle, what we can see is fibromuscular stroma. That is made up of collagen fibers plus smooth muscle, and this fibromuscular stroma is separating the follicles. and this prostate is covered by a capsule. So this is the feature of prostate.